we're going to go through our resuscitative endovascular balloon occlusion of the aorta. A couple of things first. I think Paramount is good initial common femoral arterial access, specifically ultrasound guided. One of the things I'd like to go through is just your landmarks, your ASIS, and your pubic tubercle, usually somewhere in between that. Just remember your inguinal crease. Sometimes, most of the time, your common femoral will be above that. So what we like to do is if someone comes in extremis, whether it be a pelvic trauma and or chest or combo trauma, we try to get early vascular access. We do that with the micro puncture kit. So I'm going to start off with finding my common femoral vessel and then making sure that I just get, okay, I'm in the vessel now, and it's easily going to let you get a 5 French micropuncture kit in here. That went easy. There's no any problems with that. Then after you get that in, we will use our little knife here to make a little stab incision and make sure we don't have any skin bridges. And this is your micropuncture kit and sheet. And at this part of the procedure, wire here, and it's what we call racking it, making sure it goes easy. Okay, now you have arterial line access. The question is do you need to upsize this? Well, when you're putting in your arterial line, make sure nursing gets you all set up for a arterial line transduction. And at this point, we decide, okay, we want to upsize and go for a formal Reboa insertion. And this is your convenience kit with your sheet. I'm going to get the wire out here first. And I want to say it's a .035 guide wire. And we can just take off this little dealio. And I get it set up past the wire. It goes easy through our micropuncture kit. Okay, the wire is good. And if you haven't done your stab incision before this, this is a good time to make sure you're big enough for your 7 French sheet. One of the things that this comes in with a sheet and dilator, what you want to do is make sure it locks, it pops in. Boom. Now you're good to go, okay? I'm going to go ahead and get this bad boy in here, and then I got wire on the back end coming out, and then I make sure I'm going over wire with a little twisting motion, and then if this right here should have locked. That can happen if you're not fully locked and engaged. This goes in easily, okay? And then I'm going to come out, and at this point you can be ready to deploy your Reboa. So we're going to go up here, and you ask yourself which sheet or combination of what level you want to put it. Zone 1 is below your left subclavian, and you externally mark it by going from the sternal notch to the sheet, and roughly it's about 40 centimeters. You have these markers here for a zone 3 and a zone 1 deployment, and or you can go from the xiphoid to the sheet, which will be a zone 3 deployment. Okay, so here, before we get started, is a 10 cc syringe to break the seal, the safety valve. So I lock this, and then this will just kind of spurt out everywhere. That'll break the seal, and then I'm ready to deploy my Reboa. And then one thing that I do is hook up the arterial line to this to transduce at the top of our tip, and the nursing will flush for me. And here is when we engage the sheet. This engage is right here. Boom, I'm engaged. And then I'm going to start advancing it. And roughly about 20 centimeters is whenever it gives and you know you're kind of outside of the sheet, and it'll go easily up. And then this is when you can break this little introducer sheet. And based on my measurements, I'll deploy this at zone 1 roughly, and that's when I'll either get an x-ray confirmation, and or if the patient is an extremis, I'll just kind of play it by ear and inflate the balloon. So let's go up here to this catheter to kind of go through what's going on. So your Reboa is in zone 1 based on our depth of insertion and or x-ray confirmation. And then if you look at our blood pressure, we have 2 arterial monitors, one above, one below. If you look at this side port, this is the below the Reboa catheter balloon, and this is above it. And I'm going to unlock this, and I'm going to gradually, based on my arterial pressure, start going up on the balloon and see how that corresponds to a increase in the Reboa blood pressure above it. And if it doesn't do it after 10 cc's, you may need a little bit more injection. Usually they used to say 8 cc's, but we found that sometimes it's a little bit more. But you could already tell the blood pressure is a little bit higher above it, and then below it, you're dropping, and then boom, you get a good response, and you're basically under full occlusion at this point. So let's say your patient stabilizes and you are ready to do partial Reboa. In this setting, you can start taking out a little bit of saline out the balloon and look at your arterial waveform below the balloon and getting a little pressure transduction that way. So I'm at 20. Nobody knows what the right pressure is, but I would feel good about, a map of 60 above the balloon and any perfusion below the balloon. And last but not least, before when you are happy at where you're at, you get your little clips that will, with the aortic pressure, this will migrate. So what you want to do is clip this and sew this in and document at what level you're at. In terms of good removal techniques, I'm going to show you how I do it, and this is kind of a 30 cc syringe, and I'm going to engage it. I'm going to be unlocked. I'm going to get all the saline out for sure, and once I feel like I have all the saline out, I'm going to lock it again. I'm going to squirt out that, and then I'm just going to give it another tug of pressure here, and I've got the negative pressure going, and while I have the negative pressure going, I'm going to lock it, and then I'm going to start twisting it out gently. And if you feel a lot of holdup, you may have to kind of reposition it or reinflate it and then deflate it again. And this comes out really nicely. That's it. Thank you.